Hospice Africa Uganda introduces morphine, a strong painkiller for people living with painful diseases such as cancer, HIV/AIDS, among others. Have you been prescribed morphine for relief of moderate to severe pain? Hospice Africa Uganda, a quality health provider for palliative care in Uganda, uses morphine, a cost-effective pain relief prescription medicine. Liquid morphine comes in 3 strengths. They are labeled and colored according to their strength, and these are the colors approved by the Ministry of Health in Uganda. Morphine is a self-prescription painkiller that has been approved by the World Health Organization. In Uganda, morphine is manufactured in Mulago Hospital Pharmacy and approved by the Ministry of Health.
Mulago National Referral Hospital has been contracted by the Ministry of Health to reconstitute, pack, store and distribute morphine to the health centers under the program of Ministry of Health.
As a country, we are providing the morphine free of charge to all facilities that have been accredited. As a ministry, we're also interested in ensuring that this medicine is well kept at the facility, so we are responsible for also reporting to the International Narcotic Control Board through the National Drug Authority, which is our agency in terms of usability of these medicines are concerned.
Now, as usual, with the help of a syringe, you use a clean cup.
Your palliative care doctor or nurse will show you how to measure your dose with a syringe and will update the dose on your medicine chart each visit.
Then put in the mouth, push and then swallow.
Follow instructions on your medication chart.
WHO advocates for use of morphine for pain and symptom control, especially in cancer patients, and also now in HIV patients. So according to the international regulations, the WHO has recommended to all member states that pain and symptom control in those 2 diseases should be a universal access for all patients who need it. And in Uganda, we have adopted that strategy.
Hospice Uganda mainly cares for patients. It's the care for patients that is the center of all our work. We are a model for Africa, and therefore we are training people from Uganda and other African countries to be able to perpetuate this kind of care for people throughout Africa. Because people in Africa suffer terribly, particularly from cancer and from HIV/AIDS.
For many of our patients, you can't even start to counsel them. You can't even start to think about what's going to happen to their children if they're in very severe pain. So I would recommend that morphine should be part of the essential drug list for every country that is going to give palliative care to their nation.
From giving perfect palliative care to these patients, that means looking after them, controlling pain, controlling symptoms, looking after their social, cultural, psychological, all the needs that are there for the patient and family, we will take them into consideration. If we can't look after them ourselves, we network with other organizations.
Patients suffering from short and long-term pain due to their illness have benefited greatly from the use of morphine.
I've been in the bed for 28 years now. From me, all this part, it doesn't work. I've found nothing wrong with morphine. There's no problem. For me, I've taken it since I had started this pain, since 10 years ago.
This patient came on our program in April 2006. The patient had been tested positive and had the first line treatment of ARVs, which she couldn't respond on nicely because she had got severe itching, and by the time they came in, had the second course of ARVs, which had reacted on badly. So they decided to stop it and called in hospice. And as we controlled the pain, now he's again on ARVs and has put on weight and is doing well.
Oral morphine has relieved my pain. Now I can sleep well because I don't have headaches, and I can eat well.
After I have identified patients in a critical situation in my community and referred them to hospice, they are prescribed to oral morphine, which has actually done them well.
Doctors and other health practitioners recommend oral morphine as an effective medicine for pain control and alleviation, and it's easy to take. Once you are prescribed oral morphine, you will be asked to sign that you have received your morphine. The amount given is to last you until the next review. Keep it out of reach of children. Keep it in a safe, cool place. Never give it to someone else for their pain or other reason. Please return any unused morphine to Hospice Uganda, a health facility which prescribed it, or your nearest health facility where it will be destroyed. If you cannot return unused morphine to hospice or health facility, do not keep it. Throw it down the sink, toilet or pit latrine. Record how much you're thrown away and when on your drug sheet. If you destroy it yourself, you need to sign a paper to confirm that you have done so and give it to your nurse. Hospice or your health facility has to report the use of morphine to National Drug Authority. Many people mistakenly believe that oral morphine is addictive.
We have had no cases of addiction in Uganda since we started in 1993, and we have treated 11,000 patients, and about 70% of those have been receiving oral morphine.
The oral form is very safe.
Oral morphine will not make you drug addict. Oral morphine is really addictive if you take it in a treatment of pain. For a person to become addicted, they have to take their morphine through intravenous. Pain stops you from getting addicted so long as you are having pain, because when you take morphine, it just goes in the brain and triggers the centers which are producing pain, so that you are pain-free and you remain comfortable, you remain calm, you do your work. Some health professionals, they don't have this concept of treating pain, and they normally stop patients from taking oral morphine. So what we advise them is just to refer patients to specialists who have undergone this palliative care course, so that they treat patients who are having pain.
Oral morphine is available once you have seen a doctor or specialist palliative care nurse or clinical officer who prescribes it. In Uganda, it's provided free by health units with qualified prescribers.
Although morphine is a very successful drug with regard to control of pain, the patient may experience some side effects.
The common one being drowsiness. This normally occurs the first 2 to 3 days, but if you explain to the patient and if you assess and give the right dose, this drowsiness wears off completely. The other side effect that we tend to find quite common in about 1/3 of our patients is dryness of the mouth. But like drowsiness, this normally occurs in the first 2 to 3 days. And if you advise the patient to suck on a fruit or something, it wears off and the subsequent days.
Nausea may occur, but it's rare in African patients, and we expect that within the first 2 days, it wears off.
The other thing that they normally get is constipation, and because of that, we normally advise our patients to eat fruits and vegetables, or we also give them some drugs that help them with their bowels while they are on oral morphine.
Morphine does not have long-term side effects or, say, persistent damage to any part of the body if used over a prolonged period.
If my doctor prescribes morphine for me, does it mean that I'm about to die?
No, it doesn't mean that. What the doctor is doing is to address the severe pain which the patient has. Whenever we make a diagnosis, like say a cancer or like HIV/AIDS, when somebody has got severe pain, at that very moment, if the other simpler drugs have not controlled the pain, you have no alternative but to go to morphine. So that doesn't mean that you're about to die.
Do all cancer or HIV pains respond to oral morphine?
Some pains do not respond completely to oral morphine. For example, nerve pain and bone pain. Now for nerve pain, we use drugs such as antidepressants, like amitriptyline, or like anti-epileptic drugs, such as phenytoin. These are drugs that we call adjuvants. Adjuvants are drugs that are meant for other purposes but can be used to control pain. So in the case of nerve pain, we use antidepressants or anti-epileptics to actually help the pain. You can also add morphine, but it's not completely effective for nerve pain.
Can I take oral morphine with my ARVs?
Yes, as long as there is severe pain which cannot respond to simpler drugs. And if the doctor or your nurse feels that this pain requires morphine, you can take it.
All morphine available all over Uganda?
Yes, in the areas, in the units where it is designated to be used, in the hospitals and some health center force.
Your local health center or palliative care provider may also be able to give you advice and information. You can also pick up more information from Hospice Africa Uganda. Oral morphine, the safe and effective means to alleviate chronic long and short-term pain. Brought to you by Hospice Africa Uganda with approval from the Ministry of Health and supported by the World Health Organization. This video is funded by USAID and PEPFAR.